Hello, welcome. Thank you for joining me today to talk about safety citizenship. I'm Dr. Carrie Finley, and I am a senior research scientist with the Center for Health and Safety Culture. I have a PhD in human services and a master's degree in social work from Colorado State University. And at the center, I assist really with the center's basic and applied research, looking into the definition and measurement and transformation of culture. My primary area of interest is focused on behavior change and specifically people's intentions and motivations and how those influence our behaviors. I'm excited to be with you today to talk about safety citizenship and how safety citizenship really moves us beyond bystander engagement. I'm going to start with just a few housekeeping things before we get into the content of the webinar. Please make sure you join either by phone or on your computer. To do that, just click on the phone icon at the bottom of your screen. And if for any reason during the webinar you would lose connection with the audio, you can find that phone icon and click on it, and that'll allow you to reconnect. The webinar is being recorded, so you'll have an opportunity to share the video or listen to it again. And we'll also put it on our website and on our YouTube channel in the next couple of days. If at any time during the webinar you have questions or comments, please feel free to send them in using the chat panel or the question and answer panel. And we'll be keeping an eye on any of the technical questions, and we'll respond to those right away. And just so you know, too, if you have a question, I'm going to answer any content-related questions in a follow-up email to everyone soon after the webinar concludes today. So we're going to be doing some live tweeting during the webinar, so you can, if you're active on Twitter, we'd love to connect with you on there. So we are an interdisciplinary center that conducts research on how culture impacts health and safety. We conduct applied research in partnership with communities, state, tribal, and national organizations who really are seeking to improve health and safety. All of the research that we do is applied with folks trying to make a difference in their communities. Our work covers a lot of different issues, but predominantly these four. Together, these issues have a profound impact on public health. They really are the leading causes of years of potential life lost, and they overlap. So we know that the misuse of substances has a profound impact on traffic safety. And likewise, violence and child maltreatment are impacted by substances. So all of these are interconnected. And interestingly, at the federal, state, and community levels, these issues are addressed in different ways. It's interesting to see how departments of transportation approach behavior change and health and safety and compare that to efforts, for example, to reduce underage drinking or domestic violence. Working in these domains is really insightful for us, because our big picture is to really step back and look at the overall approach that can transcend any of those issues. So I'd like to start by having you engage in a thinking exercise. Imagine that you were having dinner with a friend, and during dinner you both have a glass of wine. However, your friend decides to have 2 or 3 additional cocktails, and your friend seems intoxicated, is almost having trouble finding the check. You both get up to leave the restaurant, and your friend is stumbling or having trouble finding their keys. You ask your friend if they're driving home, and they say yes. So think about, what would you do in that situation? Do you feel comfortable intervening? Now, this was a friend. Would you feel different intervening if it were your family member? Or how about if it was a coworker or your boss? Perhaps some of you were quickly able to decide that if it was a friend, you would intervene in some way and you'd offer to give them a ride or, offer to find them a ride. Some of you might have felt really comfortable advocating for safety in that situation. Others might have been a little less sure about your response. Some of you might be thinking, well, you would intervene the same, whether it was a friend or your boss, and others might have felt a little differently, intervening with a coworker or their family member. Regardless, I hope that this exercise just started to get you thinking about engaging and responding in a situation. People engaging in proactive behaviors provides a unique opportunity to enhance our health and safety efforts. So our team was confronted with this challenge of looking at impaired driving. And we decided to start with the data to understand really what was happening around impaired driving. There's been a lot of work on the issue of drunk driving, and we've made a lot of progress at reducing the number of drivers who have any amount of alcohol and drive. But this is an interesting public health challenge because there's this small percentage of people engaging in this really risky behavior. From a cultural standpoint, we've come to a place, I think, in our culture that we believe drinking and driving is wrong. But from a public health standpoint, there are still way too many people who are driving impaired. There's a small percentage, but still a lot of incidents. This small percentage is a lot of episodes. This slide shows that there was 111 million self-reported alcohol impaired driving episodes in 2014, for example. And from a cultural standpoint, it makes me think that maybe we've reached our limit as to what we're saying about drinking and driving. And what is next? What's the next behavior that we can engage people in to address this issue? How can we take a more active role? What we know from the research is that there is this really small group of people who are driving with blood alcohol contents over the 0.08 legal limit. This really small group is causing significant risk, and there's a large majority who are safe road users and who aren't engaging in this risky behavior. So we began to think about what it would be like to focus not on this small group engaging in the risky behavior, but instead to focus on everyone else. This significant majority are really available to us as allies. So this shift in our thinking from focusing on this small group engaging in risky behaviors to focusing on this large group engaging in safe behaviors led us on this path to explore the concept of safety citizenship. And during our time today, we're going to dive into this concept of safety citizenship. We're going to talk about how this concept can be applied in your work to improve health and safety. We're going to talk about what safety citizenship is and where it originated. And we'll also talk about how we've taken this concept of safety citizenship and applied it to address specific behaviors and really what we learned from the research in doing so. And then finally, I want to leave you with just some reflective questions for exploring ways to grow safety citizenship in your specific area of health and safety. So let's start by diving into the concept of safety citizenship. Safety is a really important focus for really every field that's represented on this call. Regardless of your area of focus, we know that the majority of safety incidents and injuries are a result of human behaviors. So for example, if you're in traffic safety, you know that safety on our nation's roadways is an extremely important focus area. You also probably know that about 94% of serious crashes are linked to human choices. To reach our goal of 0 deaths on our nation's roadways, we have to affect change using novel approaches that address human behavior. If you're in substance use prevention, we know that the majority of people either are not using alcohol or are using alcohol in safe ways and at low levels. But there's a group of people who are engaging in the risky behavior of binge drinking. And if you're in violence prevention, you know that the majority of people don't engage in violence. But there's a small group of people who do, and that small group can cause significant harm. We know that you wear a lot of different hats in your work, and many of you are addressing a wide range of health and safety topics. To address safety, we have to start looking at how are we addressing human behaviors. So like the examples I provided maybe in your field, workplaces and organizations, especially those high-risk industries, were experiencing similar problems. They recognized that safety is a major concern in the workplace setting. When, accidents and injuries occur, there's a large cost to both individuals and to the company. Organizations knew that they had to address safety. They knew they had to focus their resources to improve safety. Now, the traditional approach to safety within organizations has really been to try and reduce risk by establishing good safety management practices and procedures in their companies. So, for example, companies have looked at mechanical problems and equipment, and they've developed safety policies and procedures around those things. So, for example, in hospitals, the use of personal protective equipment. Other industries using equipment inspections. And although these strategies are important, organizations found that those strategies alone were not enough to address safety. So in addition to focusing on equipment and policies and procedures that address safety, many organizations also try to improve safety by increasing compliance, essentially establishing rules and regulations and implementing consequences for not following those. Compliance is based on ensuring control and by implementing very specific rules. And again, companies realize, yes, these are important, but they're not sufficient. Workplaces realized that they could do more. They realized that they had to address those human behaviors because, like us, when they looked at their data, they also found that when looking at safety incidents and injuries, human error was a leading cause. So with increasing pressure to establish safe work environments, organizations were in search of something that would bolster the proactive safety behaviors of their employees so that their employees would initiate change on their own. And these proactive behaviors have been called safety citizenship behaviors. Safety citizenship behavior originated within organizations. So the word citizenship is defined in the dictionary as the character of an individual viewed as a member of society. It's the behavior in terms of the duties, obligations, and functions of a citizen, and the qualities that a person is expected to have as a responsible member of a community. So if we think of ourselves as members of different communities, each of us can think of our role as a citizen of that community. So if you use the roadway transportation system, then you are a citizen of that shared system. If you're a member of, let's say, a fitness club or a gym, then you're a citizen of that shared community. And similarly, let's say you have a child who's in daycare, then you're a member of the shared daycare community. Each of us is a citizen of various shared communities. And as citizens of these shared communities, we have an obligation to one another to act in ways that support these communities. So, for example, as a member of the shared roadway transportation system, we have an obligation to drive in ways that support safety, like following the laws or speaking up about unsafe behaviors, like texting or not wearing your seatbelt. As a citizen of a fitness club or a gym, we have an obligation to one another to act in ways that support that shared system. So, for example, we have an obligation not to pee in the pool or to make sure that you put your free weights away when you're done using them. And finally, if you're a member of the shared daycare community, we have a responsibility to one another to not bring a sick kid to daycare, for example. Safety citizenship really includes those beliefs and behaviors that a person is expected to have as a responsible member of a shared community. So there are multiple ways to define safety citizenship. The most recognized is this first definition, that behaviors are discretionary, they're not directly or explicitly recognized by the formal reward system, and that in aggregate, they promote the effective functioning of the organization. And you can see that these are really fit an organization level because safety citizenship did originate within organizations. But more simply, safety citizenship behavior is really those acts that go beyond what's formally prescribed of a person. It's really a proactive approach to risk management. Safety citizenship behavior is described as proactive behaviors, and they show up in a variety of different actions that extend beyond one's own safety to really support the safety of others. They include things like voicing opinions, intervening to help other people, reporting unsafe situations, staying informed, initiating change, and being a steward for existing safety programs. These behaviors collectively are what make up safety citizenship. So safety citizenship, like I said, is manifested or shows up in a variety of different ways. So I wanted to give you 4 different examples that I think illustrate safety citizenship really well. So the first example of safety citizenship is really looking at how we can proactively seek to improve safety before an incident occurs. So it's essentially choosing to be proactive instead of reactive. So there was a project done that was led by the National Council for Juvenile and Family Court Judges to improve the response of family courts to address domestic violence. And judges in Delaware, they chose to take off their robes and walk through the courthouse from the perspective of individual litigants. So the judges walked through the front door, they looked at the signs that were up, they went through security, they went to the information area, they sat in the waiting rooms, and then they entered the courtroom. And they were tasked as court judges to be proactive in thinking about how have we created a safe context for a family or a couple who was experiencing violence to really navigate this court system that they find themselves in. Are they expected to sit in the same waiting room? Do they have access to the same bathrooms where safety might be an issue? And this exercise of really proactively looking at their environment gave them some pretty critical insights about how their courtrooms were or were not keeping individuals experiencing domestic violence safe as they engaged in this judicial process. So based on these experiences, the judges ordered a lot of different changes. They wanted better separation for waiting rooms and bathrooms. They wanted more attention from bailiffs and better signage. This is an example of engaging in safety citizenship behavior to improve safety before an incident occurs. Another example of safety citizenship is initiating change through the systems that we already have in place to improve safety. So, for example, when issuing special use alcohol permits, asking the person that's applying for that permit to identify how they're going to reduce underage drinking if they're issued that special use permit. That's an example of this proactive safety citizenship behavior that can create a safer environment. This focuses on really getting a system to change behavior. Similarly, let me give you an example of safety citizenship using seatbelts. So this example, I think, illustrates the use of initiating efforts that really do focus on the large group of people who already wear their seatbelts. So using traditional approaches to engage people to wear seatbelts, our goal has traditionally been to get individuals to wear a seatbelt. And towards that goal, we've done a lot of things. We've done ads about seatbelt use in an attempt to educate. We have laws that require us to wear seatbelts. And we have law enforcement who are enforcing those laws, all in an effort to get individuals to wear a seatbelt. And these strategies, some of these strategies do focus on compliance. But when you think about this issue through a safety citizenship lens, now the issue is, how do I get a person to get someone else to wear a seatbelt? So how do I leverage this large group of people who already wear a seatbelt to influence this smaller group engaging in the risky behavior of not wearing a seatbelt. We can think about it like this. So how do I get my spouse to wear a seatbelt? How do I get my child to wear a seatbelt, or my parent, or my coworker? This shift is clearly different. There's other issues going on here. First, we know for seatbelt use that most people do wear their seatbelt. We also have an idea that those who don't wear a seatbelt might not do it on their own. If we're going to reach this difficult to reach group, we need to think about doing it in a different way. This is what safety citizenship is all about. So I'm going to turn it over now. I want to watch a quick video that I think illustrates shifting that frame, shifting the frame about wearing seatbelts. All right, let me get back to my PowerPoint. So I think that commercial, that Embrace Life commercial, really helped us to shift the frame about wearing seatbelts. It created that space for family members to have conversations about it. And I think that frame is different. A final example that I want to talk about is bystander engagement and how I think safety citizenship, bystander engagement is a form of safety citizenship, but helps us to move beyond bystander engagement. The essence of bystander engagement is that a person will get involved in a situation that they deem is an issue in need of urgent intervention. So in the moment, you find yourself in a situation that needs urgent intervention, and as a bystander, you decide to act. There's an immediacy element to the bystander engagement. You're in the right place, you're at the right time, and you decide to intervene. And I think while bystander engagement is an example of one form of safety citizenship behaviors are more than that. They also include those proactive safety behaviors that don't require urgent intervention. Safety citizenship behavior moves us beyond bystander engagement to include those proactive behaviors that extend beyond my own safety to support the safety of others. So some examples of safety citizenship that I think do move us beyond bystander engagement include things like an individual planning safe ways to get home after drinking alcohol, or a family establishing rules about safety, like we never text while driving, or we never ride with someone who's been drinking, or a workplace establishing policies like, hey, in this company, we always wear seatbelts. So what motivates people to engage in safety citizenship? Researchers have shown that there's lots of different reasons people might engage in safety citizenship behavior, but they can really be categorized at these three different levels: at the individual level, the group level, and in the organizational or community level. At the individual level, people are motivated to engage in safety citizenship because of self-preservation. People want to go home safe. They want to feel safe. They don't want to be hurt. And so there's this self-interest and this individual motivation to engage in safety citizenship. And if you think of Maslow's hierarchy of needs, security is a basic human instinct. So protecting ourselves from danger and the risks is an important driver of human behavior. Other research also supports that people are motivated to engage in these proactive behaviors without the exchange or without the ulterior motive of protecting one's own safety. So people are motivated to do good things without thinking that their good deeds will be returned. There's been some interesting work done by a researcher named Adam Grant on the motivations that people have around engaging in safety. And him and his colleagues, Adam Grant and his colleagues, concluded that motivations can also be just for the good of other people, that engaging in safety behaviors isn't all about me. So there was one study that was done by Grant and his colleagues that illustrated this motivation in a study of healthcare workers and really looking at what motivated healthcare workers to engage in good hand hygiene. And what they did is they set up, the researchers set up signs at various hand washing stations about hand hygiene that emphasized personal safety. So some of those signs said, hand hygiene prevents you from catching diseases. And then on other hand washing stations, they put up signs that emphasized the patient's safety. So hand hygiene prevents patients from catching diseases. Then they measured the amount of soap and hand sanitizing gel that was used from those dispensers that had one of the two different signs. And they also did some covert observations. And the results from their study showed that changing that single word in the message motivated some meaningful changes in behavior. The hand hygiene of healthcare professionals increased significantly when they were reminded of the implications for patients, but not when they were reminded of the implications for themselves. I think this is just one example, but there are others too that illustrate our individual motivation for engaging in these proactive safety citizenship behaviors is not purely done to protect our own self-interest or our own safety, but it's possible that we engage in these safety citizenship behaviors purely motivated by our want to do good things. At the group level, peer pressure to engage in safety citizenship has been found as a motivator. If everyone around us is doing something, we might feel a sense of pressure to engage in that behavior too. Another motivator is the principle of reciprocity and social exchange. And one of the foundational principles or foundational theories of safety citizenship is that people engage in safety citizenship through this process of social exchange. Essentially what that means is that people might engage in safety citizenship and go above and beyond what's expected of them when they feel that they have a perceived obligation to reciprocate. So for example, in a group setting or in like a workplace setting, if you feel like your workplace has created a really safe working environment for you, then you might feel as though you want to reciprocate and will engage in safety behaviors yourself. One way people have found to reciprocate is to engage in those citizenship behaviors where you go above and beyond what you normally would do. Engaging in this social exchange process can be really motivating and can be beneficial, especially in highly supportive group environments where you feel cared about and you want to give back and increase your own safety effort. But interestingly, the opposite is also true. In low supportive environments where you feel you have low quality relationships, you might actually withhold your efforts to go above and beyond, to maintain that balance of social exchange. Safety citizenship behavior is based on the principle of reciprocity and social exchange. And then finally, safety citizenship does not happen in a vacuum. These behaviors that we're talking about are either encouraged or discouraged by the culture. So essentially, the environment that values safety and incorporates these values encourages people to take more initiative to improve safety on their own. For example, a safety culture at work might be expressed in attitudes and beliefs and values of the organization that almost act as a prescription for the way that employees should work. It might include, safety is mentioned all the time, or there are specific safety-focused meetings that safety becomes a regular part of the conversation. Proactive behaviors can become part of the culture. They can become part of who we are and what we do for each other. People are motivated at all of these different levels, at the individual level, at the group level, and at the organizational or community level for a lot of different reasons, which is encouraging because if you think about what safety citizenship is, and you start to think about how do we grow safety citizenship in our work to improve health and safety, there's a lot of opportunities. I'm going to show you one more video that I think is a good example of this proactive safety culture that we are striving for. It was a video that was developed by a Norwegian organization that focuses on children, youth, and family affairs. So let me just show you this video.
First piece of feet.
I just love the simplicity, I think, of that message, and I think the video really captures the essence of growing safety citizenship behaviors. So I'm going to talk now about 3 different research projects that we have engaged in to explore safety citizenship. I'm going to focus primarily on the outcomes and what we learned about ways we can grow safety citizenship from those projects. So the first project, the Traffic Safety Culture Survey on Traffic Safety Citizenship that I'm going to talk about, was sponsored by the Traffic Safety Culture Transportation Pooled Fund Program. And the objective of this survey that we did on traffic safety citizenship was really to understand the core beliefs and attitudes about traffic safety citizenship that can influence engagement by road users to improve traffic safety. We wanted to identify important values to leverage in order to change attitudes and beliefs to grow safety citizenship behaviors. And we also hope that this information would really lead us to interventions that we could use in our communities. So we know in transportation that safety is an extremely important issue, and traffic crashes and injuries have devastating consequences. Safety is a major concern, and a lot of resources have been expended to improve safety. The transportation field, interestingly, has followed a very similar path to organizations to address safety. In traffic safety, we've worked to improve road design. Vehicle manufacturing companies have incorporated many different safety features into their vehicles in an attempt to reduce risk and harm associated with traffic crashes. The field of transportation has also attempted to improve safety through compliance by enacting traffic laws. Speed limit laws, seatbelt laws are examples of implementing compliance-based strategies. Similar to organizations, the field of transportation has recognized that although compliance-based strategies are important, they aren't enough, that we continue to need to address human behaviors, human errors, because those are continue to be the leading causes of safety incidents and injuries. Growing traffic safety citizenship by everyone is this strategic shift that focuses on that large majority of people engaging in safe road user behaviors. So we really wanted to understand that concept of safety citizenship in the field of traffic safety. We looked specifically at two safety citizenship behaviors: asking someone to wear a seatbelt and asking the driver to refrain from reading or typing on a cell phone while driving. And based on this survey, there was a lot of important takeaways that we learned that could bolster traffic safety citizenship in our communities. First, we learned that there were lots of opportunities to intervene with others. Similar maybe to what you thought when we were looking at that first thinking exercise on identifying how you intervene with a person who's been drinking and has planned to drive. In our study, looking at seatbelts, asking someone to wear a seatbelt and asking a driver to not text, we found in our study about half of the people who responded to our survey indicated that they'd been in a situation in the past 12 months where someone was not wearing a seatbelt or was reading or typing while driving. This represents a significant number of opportunities where an individual could intervene to improve traffic safety. Now, of those who indicated that they were in a situation to intervene, more than half of them did. So we know that there are a meaningful number of people who reported being in a situation to intervene. It isn't everyone, but we do have opportunity here. We also learned that social distance matters. Maybe in the thinking exercise, you thought you might intervene differently when it was a family member versus when it was your boss or your coworker. You may have expressed feeling more comfortable to talk with your mom or your child versus your boss. This is what we learned in our study too. We learned that people are more likely to intervene with individuals who are socially closer to them, like their family or friends, rather than someone who's more socially distant, like an acquaintance or a stranger. Perhaps if more people choose to intervene, even with strangers, then the prevalence of these risky behaviors could be reduced. Perhaps this finding might suggest that maybe we aren't sure if intervening is acceptable or not. Overall, in our study, we learned that most people have favorable attitudes and beliefs about intervening. So what this told us is that we didn't need to focus a lot of our effort to grow attitudes or the perception about attitudes, about peers' attitudes about intervening. They already existed. We also learned that the perception of whether most people do intervene was the greatest predictor of intervening behavior. So descriptive norms are our beliefs about what is typical among others, what most people do. Well, if we think other people intervene in similar situations, this makes us more likely to intervene ourselves. So what this told us is that we want to work to build a culture where people know that most people would intervene, and we want to build a sense that people have permission to intervene. In our communities, we need to clarify those norms and grow the perception that speaking up is typical. We also learned that a person's sense of comfort and confidence to intervene makes a difference. So even if people have a positive attitude about a behavior, they believe they should engage in that behavior, and they believe that most people engage in the behavior, they might not feel comfortable or confident to complete the behavior. If a person is comfortable intervening and they feel confident to intervene, they will more likely intervene. People might need guidance on how to do it successfully to bolster their comfort and confidence. The takeaway message for us really was, when we think about creating intervention to increase intervening behaviors, we need to incorporate ways to bolster people's comfort and confidence. We want to build that culture in our community where people know how to intervene, they have permission to intervene, and they feel comfortable and confident to do it. From this study, we learned some really important lessons about what it takes for people to engage in safety citizenship and what we can do to increase these proactive safety behaviors. Research clearly tells us that the beliefs we have influence our behaviors. And we've done a variety of different studies to better understand the beliefs and behaviors about underage drinking. And one question that we have asked on a number of different surveys that we've done with youth specifically is, would you support a friend if he or she chooses not to drink alcohol? And overwhelmingly, students agree that they would support a friend if the friend chooses not to drink alcohol. In Ashland, Massachusetts, in 2018, we found 68% of students strongly agree that they would support a friend if he or she chooses not to drink alcohol. However, 70% of these same students perceive that most students at their school do not feel the same way. Similarly, in Forest Lake Area High School, we found 67% of students strongly agree that they would support a friend if he or she chooses not to drink alcohol. But 73% of those same students perceived that most students at their school would not feel the same way. From these surveys, we learned that youth have favorable attitudes about supporting healthy behaviors like not drinking. But even though most youth say they would be supportive of someone's choice not to drink alcohol, they don't think their friends would feel the same way. These students have misperceptions, and these misperceptions might inhibit safety citizenship behavior. Again, looking at how we grow safety citizenship, perhaps some of our focus needs to be on correcting the misperceptions youth have about supporting healthy behaviors like not drinking. Again, we want to build that culture where supporting healthy behaviors is typical and normalized. The supportive attitudes are there. Now, we didn't ask if they were doing it, but they don't think that these positive attitudes are among their friends. It's a really cool opportunity to do something. This positive culture already exists. And finally, I want to talk about a dating violence survey that we did. So we conducted an internet-based survey of high school students who were between the ages of 18 and 20, and we did this with students across the country to better understand their experiences with harassing behaviors like having someone repeatedly contact them to see where they were or who they were with, making mean or hurtful comments to them, spreading rumors, and aggressive behaviors like making threatening or aggressive comments, trying to get them to talk about sex when they didn't want to, and asking them to do something sexual that they didn't want to do. We also asked them about violent behaviors like physically hurting them or someone forcing them to do sexual things that they didn't want to do. We asked about their perception of harm, their sense of disapproval, and their sense of acceptance for these behaviors. We also asked about their willingness to intervene with a friend who was experiencing these behaviors. And what we found was encouraging. Most students reported that they were willing to speak up, and most who were in that situation reported that they did speak up. Now, we don't know if what they did was helpful, or if it impacted their friend, or if it improved the safety of their friend's relationship. But it did tell us that we have a place to start from, and that there are opportunities to grow safety citizenship behaviors to help address dating violence. We have a lot more questions. We are really just starting to look at safety citizenship and how to do the work we're doing to improve health and safety through this lens. We know that safety citizenship is grounded in organization, and we want to bring it out into communities. Regardless of the issue that you're working on in your community, growing safety citizenship can improve health and safety. Integrating these proactive, pro-social behaviors into our existing strategies leverages that positive culture that already exists. Like we previously discussed, if you're in substance use prevention, that majority of people either aren't using alcohol or are using alcohol in safe ways and at low levels, and safety citizenship can really leverage that strong positive culture that already exists. In traffic safety, similarly, most people, for example, are wearing their seatbelts. Most people are not driving under the influence of alcohol. Safety citizenship engages that strong culture. And in violence prevention, safety citizenship can help us to engage the large group of people who don't engage in violence. Growing safety citizenship is an opportunity to create lasting and sustainable improvements by really instilling a sense of responsibility in everyone for the safety of others. So while we can't dive in together today about all of the opportunities you might be thinking about or how this applies, how you can apply traffic safety citizenship or safety citizenship in substance use prevention or in domestic violence, how you can apply this concept in your work, I do want to leave you with some reflective questions. Think about, how could growing safety citizenship help you achieve your desired outcomes? And what are the opportunities for applying safety citizenship to your issue right now? Hopefully, these questions can spark your thinking about safety citizenship and leave you contemplating, like, what's next? What would be the next step? Safety citizenship is an opportunity to grow the strong positive cultures that we already have, to engage the small group of people engaging in risky behaviors. Growing safety citizenship can help us move forward to improve health and safety in our communities. So we have a couple of fun, upcoming, exciting events coming up, and I wanted to share with those before we end our call today. So next Wednesday, we are hosting a webinar that will review one of our recent projects that explored traffic safety culture and driving under the influence of alcohol and cannabis in Washington State. You can visit our website to register for that webinar. We are also hosting our annual Positive Culture Framework training in the end of September in Nashville, Tennessee. We'll be announcing more details on that training in our quarterly newsletter, which will be issued next week through our email list. And we're also in the beginning stages of planning our symposium for the summer of 2020, which is really an event that seeks to bring together people from many different health and safety sectors to have the opportunity to engage in group discussions and connect with each other and listen to presentations in multiple formats that support the evolution of science and practice. This is a slide of a lot of different other services that we offer. We provide guide service to communities and organizations, and we would love to connect with you for a variety of different training opportunities. We also do assessments and surveys and evaluations, and we have all of our past webinars available on our website and on our YouTube. So if there are other aspects of our work that you're interested in, please contact us, and we'd be happy to provide you with more information there. Again, thank you for joining me today. We are active on social media. In case you'd like to connect with us on there, I will have a certificate of completion for this webinar, and I'll send that out to you through email, so keep an eye out for that. And again, I will send you a follow-up email with responses to any questions that came through on our chat and question and answer panels today. And with that, we are at the end of the webinar. I really appreciate your time today and hope you have a great rest of your week. Thank you.